All right. Bear with me. I'm just pulling my slides and my notes up.
Oh, let me stop share, actually. Did I stop share?
Still
You're
still
good.
gathering myself after Brent's performance. It's always so touching. Thank you, Brent. It's really nice to start the day that way. Okay. Yes, I think you did, Melanie. I think we're good.
Okay, and we're just waiting on Gavin Walters and Greg Johnson to reveal themselves.
The panelists are kind of spotlighted, so they're on the top, correct, Melanie?
I see that, yes, Jeremy, Gavin, yes. If Greg Johnson is on, he needs to on he needs to come off. But yes, I'm gonna work to highlight the panelists while you're talking.
All right, Melanie, do you want me to start or should we wait for Greg?
You can start, because this will take about it'll be about half an hour. I'll reach out to him and I'll see if I can spotlight the panelists while you're talking.
Okay, awesome. Thanks so much. All right, so I've been part of this conference with NASW for many years now, and I'm always so grateful that they are really at the forefront of highlighting a lot of these topic areas and really bringing down that, the stigma, bringing up the conversation, like Dr. Kennedy mentioned in the intro, to bridge that gap of communication and understanding and support ultimately for veterans in the community and veterans who are seeking services, is so important. I am not a veteran. I am a clinician. I've been in the field for over 15 years and have had the honor to work with veterans for the majority of that time, and first responders as well. And it's really been, a wonderful, beautiful learning experience being part of that community. And I feel like we're always learning because it is early in my career, there was a veteran I was working with who said this is like a current event, it's a current issue. It's something that changes in real time. Every year, every month, there's developments that affect the veteran community and then shape how we support or how we should be supporting. And I think that's just an important lens to educate from, because we do these annually, really. And the topics are always a little bit different. The panelists are always a little bit different, and I try to adjust the content according to that, right? So if you've attended before, thanks for coming back. NASW, as always, thank you so much for holding these really important conversations. And really, the highlight of the entire day is going to be not on me, but on the panelists for each of the workshops. And I will do my very best to set the stage for each group of panelists and give them the respect and the platform that they deserve to present these topics to you. So the way I do that is about 20 minutes of content first in order to set that stage. And then I jump over into asking them a series of panel questions. We do keep an eye on the chat box as well. So if you're attending and you're thinking that you might have a question that you would love to see addressed, I know there's a lot of people on, but we will try to keep an eye and maybe pull out a few comments or questions from the audience as well to present to our panelists during the second part, which will be the majority part. So this one goes just for logistics. This one goes from 9:30 to 11. So we're starting now. We'll be done at 11. Then we'll have a short break before the next. So by 10, probably a few minutes before, we will start our panel. And then we'll hear from, and I'll introduce each of our panelists. We'll hear from each of them on this topic. So this topic is about providing support, specifically peer support, but also tying in the fact that there are critical issues that we interface with, right? Suicide, addiction, homelessness, the list goes on, right? There's a lot of peripheral areas as well. So those are like the big hitting items that we see a lot about in the media, for example, and we hear, you know, news stories or stories from peers or clinicians or from veterans about somebody who took their own life or somebody who, fell into addiction and needs treatment, right? Or lost their job and now is living on the streets, right? Like these kind of critical issues, and I like to also normalize the fact that it starts with something and it escalates beyond that, right? So it's never just one day I'm fine and the next day I'm feeling suicidal, right? So we're going to kind of look at the dimensions of what can lead to a veteran feeling the impact of any of these, and just kind of pull apart a few different areas, and then turn it over to our panelists who have personal and professional experience in these areas. So a lot of, again, like these are the buzzwords. So all day I'm going to remind us to take the content with a grain of salt because every veteran is completely different than the next, even if they're from the same area, the same branch of service, they have all these commonalities. Every single person, every human is different. So that applies to the veteran population as well. I think there's often an assumption that veterans have a lot more in common and a lot more similarities than they actually do, because of the banter, I think, too, that we hear like, oh, they're all part of the same club, right? Yes, there is language and communication and some banter, just like people that all work in a hospital system, right? Like they will talk the same way, use acronyms, throw lingo around. That does not mean that they face the same issues when they go home at the end of the day or the same challenges or struggles as they navigate through life. So always keep that in mind when we're doing these. And when I bring up a slide like this and we're talking about like, hey, these are some of the buzzwords that we see, it does not mean that if you have a veteran that walks into your office, they're going to hit any of these bullet points on this list, right? So asking questions has been the biggest tool for me as a clinician working in the space. I always try to ask questions and do really that qualitative inquiry of like, where are you from? What are you dealing with? How can we help? What are some things that you want to work on that you would love to improve? What are some areas that you feel like are barriers to you? That's going to give me more information than anything on any screen, Google, book. So I am going to present information, but just let's keep that in our minds as well. So post-traumatic stress, we hear that phrase a lot: substance and alcohol use, addiction, suicide attempts, sexual trauma, chronic pain, physical injuries, looking for purpose, looking for meaning, anxiety, sleep issues, which can be insomnia, nightmares, anything of that nature, feeling hopeless about yourself, your future, not really sure where your future is going, feeling isolated, disconnected, existential conflict, meaning anything that's rooted in spirituality or identity or that person's, again, sense of purpose. Traumatic brain injuries, cognitive issues, looking for work, trying to figure out where you might fit in the civilian, employment landscape. And then integrating with family and reestablishing what your role is in your family and community in the world around you. So common trends, right? But again, that list can go on, and we're going to go even deeper than that in our panel today. So what do we look for, right? What are we looking for when we talk about critical issues? We want to look for signs, indications, that could be disposition related, and it could be clinical. It could be either. So it's what people might say, what they're thinking. Somebody might not have a clear-cut diagnosis. That's the reality too. That DSM, that they might not qualify for PTSD, depression, or an anxiety disorder, but there could be language that's driving other mental health challenges, life challenges that could lead to, I'm going to skip around a little bit, any of these critical issues, right? So there's not always a tight correlation between diagnosis and a severe challenge that somebody could be facing. And this applies, I think, to all populations. Veterans are unique in many, many ways. One of them is that their service does define a bit of where their life goes afterwards. And that's for better or worse. For some, it's they have a great experience that spirals after their military career. And for others, there are challenges that are embedded in their service history and kind of how that was a turning point. So keep in mind the disposition though and the language because it's sometimes it's clinical and sometimes it's more just life related, right? And what people are saying, we want to tune into those kind of nuances. I don't know where I belong. I don't know where I fit in. Things like that, right? We want to listen to those points. Collateral input. This person comes in, their baseline veterans are pretty high functioning. You're going to find that out today when we turn over to the panel in a few minutes and you all are blown away by the information they present. No pressure, guys. But yeah, they are impressive. And as individuals who are impressive, they can also mask issues that they're struggling with. Um, uh, Intelligence is part of it and skills and all of that, but also many veterans are trained to kind of compartmentalize their emotional state. So you get, a veteran sitting in front of you in therapy and they might seem very well put together because they're trained to seem very well put together, and on the inside they are not. So collateral input, meaning a family member, a loved one, a friend, a spouse, a parent, anyone who says, this person is not well. They were doing okay. And for the past couple months, they have not been doing well. That is really valuable input because of that kind of masking that can occur. And sometimes it is, you might have a client who does that on purpose. You might have a client that is just how they're built. That's the disposition piece of it. We're looking for high risk markers, specifically discussions around, because we know, and Melanie referenced it, the suicide rates are so high among this population. So any language that might indicate hopelessness, helplessness, lack of will to live, right? Questioning of self, questioning of the meaning of my life, introspective language like the whys and the shoulds. Why did this happen? I should be doing more of this. And some of this ties back also to complicated grief, which we've had that as a presentation before, actually. That's its own presentation. There's so many layers to that. But the levels of loss that many veterans experience, and again, it's not for all, but many of them do go through different types of loss along the way, whether that's somebody that they lost who was in the service with them, or someone in their family. Also metaphorical losses like loss of self, loss of identity, but it is worth touching on because part of the phases of post-traumatic stress, depression, anxiety, service identity, and compartmentalization, which I just referenced, and grief and loss. If you look at all of those layered together, and let's say you do have somebody who's experienced or is experiencing all of those, a huge component of many of those conditions is like denial and avoidance. And um, it's self-protective in a way to deny and avoid some of these really big hitting issues because if you look at them face to face, you might completely break down, right? So I'm always trying to honor that as well and not push too far. Like what are the things that we're looking at here? And let me respect the fact that you might have to keep it kind of pulled together on your end because there could be a lot bubbling under the surface that it would not be beneficial all at once to say, okay, let's open all of that up. So when we're talking about loss, we're talking about trauma and a lot of the other conditions that are deeply rooted. You know, why are peers so effective bringing them into the picture? I mean, the answer is in the question, right? So we're talking about really these heavy hitting, deep rooted, difficult to put words to type of issues. If you have a peer working with you, how much more comfortable might you be? The answer most of the time is like a lot more comfortable. And I never recommend one thing for any client that's not realistic. It doesn't make sense. If someone were to ask me, what do I do to take care of myself? And my answer was, I go for walks, and that was the only thing, that wouldn't make any sense, right? So we all have these long lists of things that we do to take care of ourselves. So peers, I feel like should almost always be presented as an option in conjunction with other things, right? Like I'm not saying that clinicians, civilian clinicians, and holistic services, like there are multiple usually factors that help somebody to lead them to that place of healing and recovery. But if we're not talking about peers and we're not introducing peers into the picture, I think we're missing a really big mark there. And when it comes to these critical issues, it's like it could be life or death. So some examples here that peers will inherently understand. Um, Loss of abilities due to a diagnosis, loss of family, housing, employment, loss of identity, loss of fellow veterans to suicide, overdose, or medical injury or condition, loss of brothers or sisters in arms in combat, loss of loved ones while overseas, right? And again, this list can go on and on. I just give examples, and it's partly to bring the audience kind of on the same page as us, and also just to give our panelists ideas. Um, Although I'm sure they have their own ideas as well to go with this topic. So when we're talking about the trauma response, again, I just want to bring it back to like what we see, what we look for are those things like irritability, insomnia, startle, difficulty concentrating, having difficulty sleeping, intrusive thinking, right? Being reactive to sensory stimuli, in addition to detachment from others. So all of these like hyper stimulated symptoms in combination with these understimulated symptoms. And the reason I bring this up, because this is kind of like the basics, right? But when you look at this composition in this way, again, it makes sense and it ties back to like why are peers so effective? That undercurrent there, I feel like we kind of skip over that sometimes with these diagnoses, the detachment from others, right? And Judith Herman, I reference her all the time. She writes a lot about relational healing and how healing and recovery occurs within the context of relationships. That is so, so important. So can we build that relationship between clinician and veteran? Absolutely, absolutely. But I do find that it is enhanced by the incorporation of peers. So bringing that detachment from others into the full picture oftentimes when there's a peer introduced, and I've seen peers work one-on-one with veterans. I've seen them work within group settings, community settings. It doesn't, it's not a one size fits all. There's no clear recipe, but all I know is the incorporation of peers with these issues is hugely beneficial. Many feel like they can't talk, right? So it's this, I want to scream, I want to, um, let everybody know what's going on with me. Like it feels like this invisible wound or these things that I'm carrying on my own, and I just need support. I need help. I need to communicate what's going on. But at the same time, there's that silencing effect, and it happens for clinical reasons and it happens for disposition reasons as well when we talk again about that compartmentalization effect that we see. Uh, Also, trauma is hard to talk about. So for the veteran who has experienced trauma or prolonged stress in or out of the service, one of the after effects of that is kind of being disconnected between the cognitive processing and like the somatic processing part of our brain. Like I feel all these things and these are the experiences that can trigger me, right? But I can't necessarily put words to them. So this line is all inspired actually by Judith Herman. If you haven't read her work, she's great. I don't have stock in her book at all, but it really makes a lot of sense when we're talking about this topic. And again, it just goes back to that idea of relational healing and the power of relationships in itself being a healing component. Forget the therapy services that might be employed, right? Because we're going to use those too. But just the relationship itself, if done the right way, can have such a huge healing effect. This is her book if you want to check it out. I don't reference many authors, but I try to weave in a few of them. Melanie talked about a book club. I think it is important to keep reading about anything we're interested in, and that's why we're doing this today as a learning experience together. All right, so a lot of words on the screen here, but the main quote is the one that I just kind of paraphrased before. Recovery can't occur in isolation. It has to occur in the context of relationships. And again, this is a reality that applies to all populations. I work a lot in the addiction community as well, and the incorporation of peers in that community is parallel to this, right? Like you don't walk into an addiction facility and um, you will always find peers doing the treatment and woven into the treatment model, peers that are in recovery themselves. This is a similar idea to that. I feel like that's really normalized, and the VA and other systems do use peers. Brent, I think Melanie said you're like I didn't realize you've been doing this for a while as well. You've been a peer for a very long time. So we definitely want to hear your perspective on that. But some people, like as clinicians, don't really understand the power of what that can bring to the table. So we definitely want to highlight that today. So the other side of service. So it might make sense, like, okay, yeah, if somebody is serving and they're in, sure, this makes sense. But the other side of service is where things get lost in translation, right? And that's where these questions come into play. And it's like, where do I belong? What do I want to do? You know, what are some of the goals that I have in life, and how do I actualize them? How can I make a difference in the world? Many veterans join the service, rewind. They join for a reason. There's a purpose. There's a meaning behind it. So when we flip over to the other side, if that gets lost in translation, it's potentially really difficult to navigate. So how do I unpack all that and at the same time navigate my next steps in a way that makes sense? And then like the baseline stuff, how can I make enough money now to take care of myself and my family, right? Like I had this career, for everyone who's on, what is it, 921 participants are on right now. If I were to say, okay, you're going to retire actually in a month from your career, you're going to be done with that career, you're all set. Uh, go either, figure that out and maybe go find another job with a whole different skill set. You probably can't even really take that skill set with you. You could kind of, what, 20 years, 10 years, 5 years, however long you've been doing that, you can kind of just leave that now and go figure it out. That would be really daunting for many of us, myself included. I don't know what I would do with that. So many veterans, that's the transition that they go through, that like leaving behind and unpacking and then also building at the same time. It's pretty overwhelming. And within that, it's not black and white. There's no handbook for this. Everyone is on their own kind of gray journey of like figuring that out. And some have really great traction with it and they're able to kind of like sublimate those skills into something else and be really productive and successful and feel great about it. And, I don't want to minimize that as well, because that is the story for many. But you can see the areas where those deficits can occur, right? And those challenges can occur. And yeah, for some it's like, yeah, boom, you're dropped on this island here. Good luck. Again, just that process being really daunting, and then like a peer walks into the room, right, and understands without you having to explain or over explain any of that. Um, the value of that and going back to that relational model. Even just those first few moments for many is like, oh, you see me, like you get me. I don't have to sit here and kind of lay all of that out for you. Um, So the understanding, it's a word we throw around a lot in the therapy community, but I think on this topic is really relevant. So there can be this disconnect built in between civilians and veterans, right? Like we kind of know that there's all these books and articles that reference it, the veteran civilian divide, right? We even call it something catchy. That's how common it is, right? It's there. As a civilian provider who's been in the space, I always recognize that like right up front if I'm working with somebody. I'm like, hey, I'm a civilian. I want to help you, right? But I'm not going to pretend in any capacity that I've been through what you've been through or can understand on a peer level. This is what I can do for you, though. Right. So if you are a veteran clinician working with a first responder, with someone who served, it's okay. Avoid avoidance. It's okay to bring that up, right? Like let's not let that be an elephant in the room because you're setting the platform for the person. I've worked with veterans who prefer not to work with anyone of a service background, right? But if someone needs that and they're like, actually, I really feel like I need to talk to somebody who's been through what I've been through, let them bring that up in the first session, right? But it's better to not avoid it, right? All right. So without going into all the statistics, because they change constantly as well, and it's like I carefully throw these in there, but yeah, homelessness rates, suicide rates, overdose rates, and even employment and divorce rates are much, much higher among the veteran community than the civilian community. So I'm going to pose a question to everyone who is signed on today. Because I'm about to pose a lot of questions to our panelists and introduce them. I'm excited for that. But how can we apply peer support strategies to improve veteran well-being? That's the question. How can we do that creatively? How can we do that realistically? in our communities, in our clinical settings that we work in, right? And that's kind of like the background question I want everyone to consider as we listen over the next hour. So for a lot of peers, and I think last year we did a whole presentation on peers. I was looking over my notes because again, I'm weaving it in here, but it is its own topic as well. But there's a lot of reciprocity there as well, and I want our panelists to talk about that today too. You know what you get from the work, right? So there's this it's built in reciprocity, which is also a beautiful thing, and components of it can be self-disclosure, giving back, kind of some restorative work on both sides, effective mentoring, helping to navigate resources, provide validation, understanding, informed guidance. Lived experience is a really valuable tool. It's not always needed, right? So even just by being in the room and being somebody who served alone can sometimes have that impact. Um, but for some, that self-disclosure and kind of tying in the lived experience here and there, you know, appropriately, can be a really effective recovery tool. And again, this applies to other communities as well. This is not like the veteran community invented this, right? The use of peers applies to like a lot of different populations, and it does have a lot of benefits to it. So lived experience, self-disclosure, though, and again, I'm gonna ask you guys about that too, to our panelists. So that's gonna be kind of one of the questions in terms of how you navigate that and the benefits you've seen with disclosing. All right. So what else can we do, right? This is why we do this, and I want to set the tone, hopefully, for the whole day. We want to strengthen our competency and understanding of veteran experiences, right? That's why we're here today. And again, like shout out to NASW. You do a great job every year making this happen. Obviously, you get so many people that attend and sign in, and I appreciate the fact that people are so interested. So thank you for those who signed in today. And obviously, we can't do any of this without our panelists that we have throughout the whole day. So, recognizing the work that we're doing, the importance of the work that we're doing, right? We are in the middle of like a few crises, right? There's the opioid epidemic that's still going. There's mental health crises out there, suicide rates. Since the pandemic, the mental health rates have gone up, right? There's needs, there's gaps. There's always more that we can do in the community. And I do believe it starts with competence and understanding. You can kind of go into it cold and learn, but why, right? Like we can kind of prevent a lot of these issues by building our competence together. So when we're talking about critical issues, the other thing I want you to think about, and I think these are our last slides here, how to bring it up too. Because some people might be thinking like, okay, but what if this comes up? How do I bring this up? And how do I bring this up with a veteran? Like, we don't want to intimidate this topic today. We want to normalize this topic. So asking very normal questions like, have you been feeling overwhelmed lately? Do you have a lot of stress going on at home or at work? Do you feel hopeless? Do you feel frustrated? Do you ever feel inadequate or insecure? Like, if these things are coming up anyway, right? And you notice them, ask the questions. It doesn't have to be, are you feeling suicidal because you served in the military? No, that is not the right question to ask, right? So essentially, that's what we're talking about today is critical issues. But the way they get there are often these very normal, just therapy questions, right? It's not necessarily a formal screening, although we can do those too. And it's not necessarily going right in and being like, hey, you served, you're a veteran, therefore, and asking these, like, some of these are just very normal questions that we could start with. Do you feel that you struggle with finding purpose or meaning in your life? You know, do you have resentment? Do you have anger? Do you have regret? Do you ever feel like you need to escape, need to get away? Do you ever feel out of control? Do you have trouble sleeping? Someone might say, yeah, I haven't slept in like 4 nights. Okay, that's helpful. Let's go into that. Why? What's going on? Do you ever feel like your mood has extreme highs and lows? You can't control them, right? Questions like that can really be the gateway to engaging in this conversation about critical issues. And then also, like, are you aware of services out there that could be helpful to you? Some people, they don't know, right? They don't know what they don't know. And we might assume just because you know that there's 10 services in that area, um, not everybody does. And then, yeah, I mean, we're talking about addiction. We're talking about suicide. Do you ever feel like you need to cut down on things that you're using, alcohol? Do you ever feel like you drink too much? Do you isolate? Do you withdraw? That's a big one as well. Does anyone else in your family tell you that, your habits are not great, right? Like however you want to phrase that. And if so, like why? What's going on? Maybe you're unable to function at the level you want to be. And then obviously asking good questions and then we listen and hold the space. So just like you're going to see today, there are peers also in like leadership and advocacy positions, which is really important. And that's again what this conference is all about. I mean, a lot of these people are involved. They're on the board. They're on the committees, right? They're involved in our communities. They're in positions in our communities that can really influence and have a great positive impact on the work that we do and the services we provide. So I want to segue over and introduce our panelists. I'm not going to read bios because it would take so long. And every panelist that you're going to see today and tomorrow, sorry, dogs are chiming in. They are stacked with credentials and experiences and bios that are really impressive. So I want each panelist to tell us a little bit about yourself, though, please. So if you can give your own bio, I think it would be more organic that way. So first question to kind of kick it off, and please, each panelist just lead with like, hey, this is who I am, and this is a little bit about me, right? Uh, can you start with a really simple one? Tell us why this panel topic is important specifically to you. Who would like to start? Danielle, you want to start?
Yes. Good morning, everyone. Hello, my name is Danielle, right? I'm a licensed master's of social work. I graduated from Fordham University about 4 years ago. And I've had some various roles in social work to include working with the Addiction Institute at Mount Sinai. And now I'm currently working at the World Trade Center Health Program as a monitoring social worker. And this panel, is important to me because right now where I'm currently working, I do work with veterans and first responders. And I'm in a very nice, unique position to where we can talk a lot about the resources for veterans in New York City because I'm tapped into a lot of the resources like the RWB, the Wounded Warrior, Hope for the Hope for the Warriors. So we can discuss a lot of those things, like the VA hospital. I myself am a member there. So if they have like veteran specific programs, we can talk about it while I meet with them. So that's why this was very fascinating and I'm glad to be here. Thank you.
Thanks, Danielle.
Hello, everyone. My name is Brent Russell. I'm the Director of Veteran Services at the Mental Health Association of Nassau County. I am an Army veteran. I served from 90 to 92. And I'm grateful for that experience, and I'm grateful and love the job that I do and the different connections that I have to the community, to practitioners like yourself, and also to veterans like myself. And the reason why I like this panel and I chose to be on this panel is because I believe in peer work. I believe in it because of my personal experience. And if you would ask me, what do you want to talk about, Brent? What do you want to present on? Do you want to present on veterans mental health first aid, or do you want to present on your personal experience? I probably would say my personal experience because to me it's real. And peer work, being a peer, being in a relationship with a peer where you're able to connect with this peer and this peer can help you is powerful. You know, it's a powerful thing, and it works. Recovery is a real thing. To be able to recover from substance use, to be in recovery from a mental illness, all of that is real. And I believe that peer work is a big part of that success.
Well said, Brent. Thank you. Jeremy, you want to jump in?
Sure. Good morning, everyone. My name's Jeremy Duers. I served in the Marine Corps from 1999 to 2004. For me, this panel is extremely important, simply because I would say we have a number of veterans out there that are struggling to connect with their community. I think many of us felt this after we left boot camp, that all of a sudden we're just different than those that we encounter in the civilian side. And I'm not going to say the problem gets worse, but what happens is, at least from the Marine Corps aspect, I feel like the military makes you more of what you already are. And in many instances, and we like to generalize and think that all veterans are noble and upstanding people, but that's not always the case. They learn some very bad behaviors in the military, and they're exacerbated by combat service, perhaps MST. There's a number of things that happen to folks within their time of service that we have to redirect them. And I know in New York State we have the Dwyer program, and I'll tell you what, it's a resource that I wish every state had, simply because very often a veteran is not going to ask for help. There's a stoicism that kind of comes with their time in service, where they're like, "Oh, I'm good," and they're not going to disclose this because for whatever reason they're keeping up this veneer of hardness of service, and that they don't want to disclose that soft underbelly of vulnerability that they have. So what they do is they carry this around with them. And sometimes if they can't cope through healthy means, they start turning to unhealthy means. And then that you wind up getting into trouble with the law. So the Dwyer program, we, for at least for our Warren and Washington County iteration, we sponsor events that are free for veterans and family members to get them to connect with other veterans and other family members. And it provides us with an opportunity to triage and figure out what's going on. And we have to have a number of resources in our back pocket, both VA and non-VA, because you find a number of veterans are like, no thanks, I don't want to deal with the VA. And sometimes that's, that could be for a number of reasons. They may have had a bad a bad reaction to what they've, maybe being turned down for service-connected disability. They might have dealt with a clinician who maybe chose the wrong line of work. That type of stuff happens. Whereas the peers, we all say, hey, we all had to deal with the suck in some way. So when you kind of bring that out, all of a sudden the barriers begin to come down. Sometimes it takes a long time, sometimes it's instantaneous, but it's a tremendous power to be able to connect directly with veterans who are going to be guarded. They're going to shield themselves from outside influence and outside assistance as well. So this is a tremendous opportunity for us to learn from one another and hopefully help the wider veteran community at large.
Thanks, Jeremy. Gavin.
And thank you. And hello, everyone. Gavin Walters, United States Air Force, 2003, actually Jan 2003 to October 2003. And I actually always been embarrassed about my time in service. I was medically discharged and I didn't get to serve my time out because of some issues that happened medically in the military. So I'll say I was one of those individuals that got out, resented the military, hated the military, and I would never talk about the military. But if you come to my house, you're going to see an Air Force flag flying right in the front porch because it took, I'll say it took time for me to learn and understand that, you know, you don't have to be embarrassed about your service, you know, and then one, it wasn't your fault, but two, it was another individual that served in the military that said, Gavin, you know, you need to think about how, you know, you went in, and then also don't blame yourself. And that was an Army veteran that said, you know, you should rethink how your thought process is. And that's where, you know, I think it's important where, you know, when you connect with individuals that have served in the military, whether it's a long, you know, that whole 20 years or 15 years or whatever it is, their experience, you know, has all unique. And when they come out, like so much of the panelists have said, you know, their unique experience really can help someone, you know, move forward in their life. And for me, being this is important because it saved my life, you know, and how much of these connections save each one of our lives, as well as allow us to find a purpose in our day-to-day lives. And you know, the Dwyer program, which I'm going to emphasize as well too, is definitely one of those programs that emphasizes connection, camaraderie, support, and it's like bringing back family, where sometimes you feel like you don't have, but with your brothers and sisters, you know, you could have a conversation with somebody when you go to the VA, that those few minutes while you're waiting to get blood drawn, and you just have a whole conversation about anything, and that's just peer to peer, where you just connect with someone and that's it, you know, and that's where I know peer to peer absolutely can help and you know, really impact someone's life. Thank you.
I'm not sure if
To
Brent.
add to that.
Oh, go ahead, Brent. Yeah.
Thank you. I can identify with you, Gavin. I kind of went through the same thing, and I was honorably discharged before I was supposed to complete my service, and it took me a very long time to be able to say that, right? Because I was ashamed, because it wasn't the way that I thought it was supposed to be. It wasn't the way that it my military service didn't happen the way that I dreamed it would. And the one of the things about peer support that is so amazing, one of the feelings that comes from being able to identify with a peer, and I'm going to entitle it identification. That feeling of identification, knowing that you're not alone, knowing that you're not unique, knowing that someone else went through this challenge, or these negative feelings that are beating me up, and that they've come out on the other side of this, or that they've gone through it and they've survived it, or that they've gone through it and they have excelled regardless of it, is magical. And that's the best way I can describe it, as it being magical. It's a magical, freeing feeling to know that not only did I not go, I'm not the only one, but somebody else went through it and they overcame it as well. And that's peer work.
Well said, man. Love that. And I think the metaphor is just in even seeing somebody else who's been through it and having that person in front of you, you know, it represents what you can do too. It automatically gives that hope and motivation. So, you know, my next question was going to be kind of about like the darkest, most critical issues and how peers can meet fellow veterans in that space, right? So Brent, you're kind of like, you kind of helped me to segue into that, right? But the magic of the peer work, can you speak about how that can apply to that like contextual situation where there's something major going on? And it can be some of the things I referenced, like, you know, suicide addiction. It could be anything, right? It can just be like a life breakdown that the person is having. Like, I don't know what to do with my life, right? Can you speak from either a personal experience or just an example, what you've seen in terms of peer work being applied into those situations as well.
Aynisa, did Greg get to introduce himself?
Greg's on. Hi. Greg, I'm so sorry. Before we go into that very big question, Greg, can you please introduce yourself? I apologize. I didn't see that you joined. Thanks.
No worries. Thank you very much. Sorry for the technical difficulties coming in here, but so my name is Greg Johnson. I am a 10-year Marine Corps veteran, also the executive director of a nonprofit program called the Summit Project. So, you know, I love your question that you just asked. I think one of the biggest challenges that I faced being inside the military, you know, we all experience a lot of different things. We all have, depending on what time period we serve in, depending on what's going on. You know, I had the opportunity to deploy on 5 different occasions to 3 times to Iraq, once to Afghanistan, once to Southeast Asia. I had an incredible team that I was over there and was able to deploy with. Those were honestly some of the best times of my life. In many ways, it was also some of the hardest times of my life in many ways. But I think that, you know, when you go through these situations and these challenging places, you know, even if you're going to go through some of these dark times with, you know, your fellow peers, you've got your peers that you can lean on and support yourself with. So, you know, fortunately, I had this incredible team and was able to come back. Fortunately, I had a lot of people that weren't able to come back at the same time. So I think that was a challenge for all of us. But at the same time, it was weird because I felt oddly comfortable being in that type of environment. I think we all did because we had each other in that capacity. I think the hardest part about being in the military for me was actually getting out of the military. When you're in, it's almost like when you're on a deployment, you have this sense of purpose. You have this, you're fulfilling the goal that you set, you know, when you first came in. For me, that was easy, right? It was the hardest thing was when you leave those gates for the last time and, you know, you have something that you're comfortable with. You have this peer group. You have your fellow Marines that the culture is similar to you. It's normalized. You go out and when you leave that base for that last time, you know, I think the hardest part was watching the front gates kind of disappear in that rearview mirror for the last time. And knowing that you were never going to go back on base. It's almost like when you leave there, your entire purpose just kind of left at those gates at the same time. I was lucky enough where I came back to a place where in Maine has got a huge veteran population. It's got a huge veteran network. Not everybody necessarily has that, but I think I'm fortunate because that's one of the places that it's got, like, that's what I tell, you know, my peer, my fellow veterans in Maine. We have this huge support network that's just built into the entire state. And I got lucky about 2 weeks after I got out of the military. There was this idea that I heard that was floating around, and it was about from this gentleman who was also a Marine, Semper Fi. And he wanted to have this very special way that he honored fallen service members in the state of Maine. So what we did was I reached out to him. I said, hey, you know, this is who I am. Got out of the Marines 2 weeks ago. I heard everything that you're trying to do. I think it's an incredible idea. What could I do to help? And we kind of teamed up, and ever since that point, we built this program in the state of Maine that honors fallen service members who died post 9/11. And we work very closely with all their Gold Star surviving families and helping people in the community, kind of fulfilling that. I found that purpose once again, but it wasn't in a military setting. It was in, you know, in a civilian setting. So I think that was probably the biggest thing for me is getting out, is being able to come into something like that. And knowing that there are people out there and there is other ways that you could still fulfill and find that purpose that means something to you. And it's been incredible ever since.
Greg, thank you for that. So Greg kind of did his intro and then answered that question a bit as well, but feel free to jump back in. Can anyone else speak to that as well? Kind of the critical issues and how peers can meet fellow veterans there?
I want to piggyback on what Greg said, because the transition from military to civilian is extremely difficult. And I've lost a few buddies that weren't able to make it, at least, you know, and again, I can't speak to other services. In the Marine Corps, no matter what your billet was, no matter what your rank was, you always knew someone you could ask questions to and they'd steer you in the right direction. The civilian side, that's not necessarily the case. And we find that once we get out, many of the skills that we acquired, especially the hard skills, don't translate well into civilian sector jobs. Okay. I could say to a potential employer, yeah, from 600 yards, man, I got you. But where do you use that? I think the soft skills, the leadership, the mission accomplishment, the focus on getting the job done, that certainly translates, but that's not on a resume. So that's where the peers come in, and folks within the community that can say, hey, we've got this great dentist in the area that takes our dental. Oh, hey, the folks over at the Department of Labor, she's a veteran specialist. She'll help you, adjust your resume to take your CRB and turn it into something that's workable. Or your SRB, I should say. So all these things that we, kind of maybe flounder when we first get out. I was still a relatively young man going into college. And I'm like, I have no idea what I want to study, but I have this GI Bill money that I've got 10 years to use. If I don't use it, it's going to go away. And, I think the VA is doing a good job of opening it up to other trades as well. So it's not just necessarily college, because college isn't for everybody. But I'm also finding out, as a matter of fact, I can kind of put this out to everybody. I just found this program because my educational training is in history and political philosophy, but there's New York has an initiative where they're paying for you to go into the medical field, whether it's nursing or social work. And Gavin and I have talked about this before. There are a number of veterans who want to help other veterans, but as much, we used to call them sea lawyers, where they're like, yeah, I know this, but they're given all the worst bum scoop out there, but once you get the training, even just as a peer, but then take it a step further as a licensed counselor, a master's in social work, there's opportunities out there, and I think there's a demand. There's a number of veterans who want to go into that field because they're like, hey, I survived. I want to give back. I know there's other veterans that are struggling. And I've said this several times before, just as we know people in our personal lives who freak out, over the spilled glass of milk. And then there's on the opposite end of the spectrum, the building could be burning around you. And they're like, hey, we better get outside at some point or we're going to burn. Totally calm. Those types of folks, that range of personality, join the military. So each one comes out perceiving and experiencing the whole gamut of things that we go through in the military in a different way, and it affects them differently. So many folks want to help. And if they have an opportunity to continue on with their training and education, it's a powerful tool. Not only the peer work, but also the opportunity to get a master's degree in social work. That's tremendous. Think about the powerful tool you become when not only are you trained as a peer and you've experienced it, but now you've got the counseling aspect. That's tremendously powerful.
Hi, I would like to follow up on Jeremy. Jeremy, everything you said really spoke to me because that was some of my experience as well. Because I was working in military intelligence, so switching to social work, like a whole new career, was quite an adjustment. Moving back to New York City was quite an adjustment. Going from a working adult to a full-time student, quite an adjustment. And the peer support, the community definitely helped me from drowning, essentially. And they did let me know, even as something as simple to someone else as the dentist is not as simple. Because in the military, you go to the dentist, they do what they do, then you go back to work. But in the civilian world, like, are they in network? Do they accept your insurance? So even like little things like that, and then boom, I was smacked with like hundreds of dollars. And then I reached out to my peers in community that has done it before, and it was like, well, this is, is a lot different. Yes, thank you.
Thanks, Danielle. Anyone else? I'll keep segueing into other questions. You don't have to comment on everyone if it doesn't fall to you. Brent, I don't know why you moved up to the top there. I think that might have been an accident, but we still see you up
I'll
there.
fix it.
Okay, thanks, Melanie. All right, any other commentary on this before I move on? Oh, there he is. Good.
I'm going to post it's called Caring Gene. I'm going to post it in the chat, the link to it for veterans in New York State who are thinking about going into the healthcare field, because it's not just social work, but RNs. My wife is an RN, tremendously difficult job. And I think veterans are well suited to head into that field because it's tremendous rigor, can be mentally exhausting, and we're kind of tempered for that type of stuff. So the demand is so high, and we're always talking about veteran employment. We look for opportunities to try and get out there. This is a great one. So I'm going to post it up in the chat for anybody that's interested.
Thank you, Jeremy. So my next question, and if you have other thoughts on other areas, feel free to bring them up. How would you know if a veteran client could benefit from peer services? How do you bridge that gap? What are some things to listen for? I guess like in screening for, I think probably everyone could benefit, but like specifically somebody who really needs it, right? What are some things to listen for? And again, you could bring in like something that happened to you or something that you saw happen to a colleague, a friend, a client that you notice. Like if it's easier to bring up a case example or speak about it generally, either way. But what are some things that we could tell our attendees today to kind of look out for in terms of making that connection?
Yeah, I'd love to speak on this because that resonates with what's happening with me right now. Um, I'm actually seeing a mental health provider that's retiring today. And I think I've shared this before on like another panel or so, but my mental health provider was actually a special request by myself. I said I wanted an African American male veteran that understands and can, talk to me basically. And that's what I was able to, achieve. And I was like, awesome. Like I'm talking to somebody that resonates with me, someone that connects with me, someone that could talk about if my son is experiencing racism as a young boy. Like I could talk about something where military related too, and that those are things that really for myself getting mental health service. I'm like, that's amazing, but he's retiring today, and I told everyone like if he ever retires, I'm never going back to the VA. And I'm going to say this right now, I'm the VA, the Hudson Valley VA does not have another African American male clinician. And I'm like, okay, who am I going to go to now? And that's, and I'm only saying that because I've spoken to individuals like, and for a lot of us, and I shared this before, like being from the Caribbean, talking about your mental health and talking about how you feel was not part of my growing up. So just being able to have somebody that I was able to connect with and reach out to, I was like, okay, this is interesting. This is different. I'm actually resonating with someone that I'm not afraid to not talk about different things and feel comfortable. And I say for a lot of us that go to get our mental health treated, like sometimes it feels like we're just talking just to check the box for the VA so we could continue on with our day. And then when you actually meet someone that you're like, wow, I'm actually getting impacted. This is actually impactful to me. I'm talking to them, I'm having a conversation opposed to someone checking the box to make sure they are talking about what they learned in school opposed to like how they should be treating myself or someone else. And for that, it's like, how do you, those are hard, I hate to say, but those are hard to find individuals where they actually resonate with you and have a conversation and not try to talk to you. And there's a difference between those type of services, because you don't it just feels so uncomfortable sitting down with someone that just stares at you and you're like, okay, what are you going to ask me now? And am I going to say it correctly so you don't put it in my chart so that way I don't get flagged for something? And if I have to walk an eggshell to talk to you, then I don't think my treatment is going, where it's supposed to be. And if I could feel comfortable talking to somebody, that's when someone's able to like say, hey, I feel like killing myself yesterday. And it's because, this was happening, I experienced that. And that's just a natural conversation what people have. And that's peer. That's peer, that's just peer connection where you can actually talk to someone fluidly like you met them yesterday or you knew them for 20 years. And the next time you guys talk, it's like the same thing happening. And that's where I'll say, when it comes to just us as individuals, looking for, someone to connect with, it is hard to find someone that you could build that rapport with because if they'll know how to talk to you, you're gonna feel like you're just gonna you're gonna set yourself up to where you don't want to share too much, and then the experience of like healing is not gonna happen. And that's where I say like today I'm not for sure if I'm gonna be able to heal because once he says he's retiring, I was like, are you sure? You're not you're joking, right? And it took me a while to actually accept the fact that he was leaving. And I told him that I'm going to write to VA today and let them know that they better find a way to keep him per diem because I'm not coming back to them. So I just want to point that out.
My experience with peer work is that um, it's to I guess to give an example, it's almost like you're in a bad place. Individual I'm doing peer work with is in a bad place or can be in a bad place. It doesn't have to necessarily be bad, but in a place where they need support and where they need help. And it's not for me to come out of my pocket and put you in a hotel. It's not for me to um, uh, go to your house and um, talk to your wife and things of that nature. But I'm there in a supportive role, and I'm there to kind of like be and sit in the trenches with you as a support. And I do that not only by listening, but also by sharing my experience. And there are certain virtues that go along with peer work, such as honesty, such as empathy, and so forth and so on. There's about 10 or 12. Um, um, the the what I feel the difference is between, well, let me highlight some differences I think that are between clinical work and peer work. When I go to my therapist um, talks to me. We go back into the past and we talk about these traumas and we talk about wounds and so forth and so on. And we identify when it happened, and then we identify different behaviors that started around that time, and we identify the behaviors that are connected to that time way back in the past. And sometimes she will highlight the discrepancies of my conversation so that I could be, on point, and not living in a fantasy world and so forth and so on. And so I think there's a point And it's funny because I work in 2 different agencies, and both of my agencies have hired peers. There are peers in our agencies, and our peers talk to individuals, and our clinicians have sessions with individuals. So there can be a point in the clinical relationship where an individual can benefit from a peer relationship because clinicians can't go where peers can go, if that makes sense. And so I'm a firm believer in both of these tactics to help people to heal and to get better. Like I really am. I take my hat off and put one on, and take that one off and put the other one on. Constantly. Yeah, that's what I wanted to say.
Right. Anyone else on this question? Greg, did you want to say something? Go ahead. You're muted, Greg.
Thank you. It's gonna slap me around a little bit. It's okay. So no, from a different angle. So this is the challenge. I mean, I think it took me many years to realize that it would benefit me greatly to be able to talk to someone about my past experiences, you know, and using the VA was definitely a great opportunity to be able to do that. I think my biggest challenge was always going to be, did the person on the other side actually know, or could they relate to what my past experiences were? And if they couldn't relate, or couldn't relate, would they be able to actually understand where I was coming from and what my challenges were that I was facing and overcoming? But I will say that there has been a whole different side, instead of just professional therapy or services, that I've been able to get through the VA. Through my nonprofit, the Summit Project, we have a very unique mission. It's to honor our state's post 9/11 fallen service members, and through education, fellowship, and physical activity, provide assurance to their families that these sacrifices will never be forgotten. So we work very closely with families, Gold Star families, who have lost a loved one during their time in post 9/11 military service. They'll invite us into their homes. They'll teach us about the loved ones that they've lost. And then when they're done, they go out and unearth these large stones that all come from special places in their lives, whether it's a favorite fishing hole or a fireplace, or a favorite memory that they had with their loved one. And then we take those stones and engrave the names of their loved ones on there, and invite the community to come forward, and they carry these stones on treks and adventures all around the world. I've been very fortunate to be able to work close with these families, and not just the families, but what I found is that the people who come in and be a part of this organization all have relative experience in similar areas. So the families themselves, I think the biggest challenge that they have is that we talk about, they have the same challenges that we do. Are they able to connect with somebody who actually understands what they're going through? There's no one who can truly say, I understand exactly what you're going through, how you feel, and tell that to another Gold Star family, except for another Gold Star family. So when we do these events, we bring people together, we go on these hikes, you know, these families come together and they build these relationships with each other, and they're able to offload and they're able to talk. And I've had a number of different people, different families come forward and say that before they were able to do this, you know, they felt that they were in a silo and they were alone. I think one of the families kind of put it best. They said that when their son had passed, that their world completely stopped. But then they looked around and everybody else's life continued on. And their initial fear was that their son and their son's memory was going to be permanently left in the past. And this was our opportunity to kind of tell them that they're not alone. And, you know, their son's life and their son's legacy would never be left behind. But there are people that will continue sharing these stories every single day, and there are families that are going through this every single day. Not every day is a good day, right? You're going to have good days, you're going to have bad days, but the bottom line is we all do this together. So when these families come forward and they're able to interconnect, it's not through an official therapy session, but it's just about being around like people. I've lost a number of friends that were in the military myself. None of them are honored within the program specifically, but being able to support these different families and being able to honor these fallen service members, it also inherently helps me through some of the challenges I've faced with friends that I've lost at the same exact time. Being around other veterans who come across the same challenges, same experiences that I have, being around them and kind of being in a safe place to talk about it. It's not necessarily in a doctor's office or on a Zoom call. It's actually going out there in the community and doing positive things with each other, and you're almost rebuilding that entire connection that you had in the military in the first place. You're just doing it on the outside. So, I mean, we've had thousands of people that have come forward to be a part of this, and we've really kind of transitioned a lot of that, those mental health challenges through the work that we do and putting it in a positive way, being able to kind of use those efforts to get back to the community. And there's so much healing that comes with that. But yeah, just being able to be around like-minded people. It doesn't always need to be in a doctor's office. Sometimes it just needs to be out on a mountain or on a trail. Sometimes it needs to be at a gathering or, but it's just being around those people that helps so many people in different ways. And I think I found that personally. And, fortunately enough, a lot of the friends that we've made, the friendships that we've made in the program, continue to hear the same exact thing, from their perspective.
Just to piggyback on what Greg's saying, I think many veterans, especially over the last 5 years since COVID, have a tremendous amount of skepticism towards the medical field. Getting outdoors is vital, I would say. And so hiking could be something as simple as fishing. There's something called forest bathing, where you're just kind of sitting there soaking it all in. And I heard that term because I'm learning so much. I heard it and I was like, oh, what the hell is that? And then you go do it, because I've been hunting a few times. I wasn't much of a hunter. So I would say my time hunting, because I actually didn't shoot anything, would be very akin to forest bathing. And it was awesome. And I could see where a number of our veterans might be like, this is right at home for me. So another thing that we've done for our veterans through the Dwyer program, we started a veteran softball team, veterans and family members. So we're competing in the local city rec league. We started bowling leagues. We've got these different things that are non-medicinal, non-prescription drugs, because not only the connections and relationships that you're making, the physical activity, being outdoors, laughing, joking, all of these things that we have an opportunity to do just by being active can maybe preclude some of our veterans from having to get on some of these medicinal treatments that, when you read the side effects of some of these, you're like, man, is this meant to help them or hurt them? What are we trying to do? When you see, the person might have suicidal ideation for, 4 weeks while the medicine's taking effect. And you're like, well, that's an awful long window for someone who's unstable anyway. So we're trying our best up here to do these holistic connections, outdoor activities, hikes, climbs, all of these things. And I agree with Greg 100%. This is where we connect with other folks who are feeling a tremendous amount of isolation. It's been a long time coming. I've been in the program for 3 years, where I'm connecting with local addiction centers now, and I'm leading these veterans groups. And now they're starting to come out and participate. And to see them, really having a really gloomy outlook on life, go from that, their starting point to now, months later, connecting and smiling and laughing, and now they're going camping with us and heading out into the wilderness, and you can't help but feel that it's having a positive outcome for not only the veterans but the family members that are connected with them, because they see that they're suffering, they see they're in pain, They don't want that. And the last thing they want is someone who's medicated and now, perhaps a zombie because of, the treatment that, and going back to what Gavin said, the VA has a tendency to blow through clinicians and doctors. You'll be seeing someone 1 month, 6 months later, you got another doctor and you're like, do I have to go through all of these steps and explanations to tell them where I'm at? And then, I've had a couple of that. The first thing they want to do is put you on some medicine. You're like, man, I don't want to do that. That's no good. And then you start to get into that whole realm where you're like, oh, am I going to lose my disability because I don't want to take the medicine that they're putting me on, that I have to take, an infusion every 3 weeks and it's going to knock me out for 2 days. It's not necessarily conducive to a productive family life or work life. So we feel that these alternative approaches to treatment and to making connections are far more beneficial than, the first, reaction of a doctor to just throw medicine at it.
Danielle, did you have a comment too? These are great.
Yes,
Really
I did.
Yep.
I'm so glad because this is my first time hearing about the Dwyer project, Dwyer program, excuse me. And I'm going to absolutely, get more familiar with what it is, and absolutely forward it on to some of my patients who have been, sharing with me, issues with being able to connect, and or they're just like mentally tired from like everything that's going on in the world today. So, and I also love forest bathing. Sometimes I go up with Homeward Bound, that organization, to the Catskills, and it's completely covered for veterans. You just have to literally show up, and they do a lot of forest bathing. They do the fireside chats, which are very, very therapeutic in a non-clinical space. And then also because I know like I've been keeping up to date with like a lot of the programs like that the VA does offer, like the health and fitness programs. And then also I know that they have like a Women's Veterans Day coming up. And I believe it's in Brooklyn. So like those type of informations I absolutely do utilize for myself. And then I pass it on, to any veteran, whether it's my patient or not, that I like, connect with. Thank you.
Great.
I wanted to just say real briefly that peer work is reciprocal. And I'm kind of piggybacking off what Greg was saying. And also that my staff, my staff are peer certified. When what I found out is that my staff do peer work with each other. And I thought that was amazing, that that peer relationship doesn't just go from peer staff to an individual, but it goes from peer staff to peer staff as well. And I thought that was really something that's amazing and something that I just wanted to mention.
It is applicable in multiple directions, right? Yeah. I think Melanie has a comment and a note for the attendees. Go ahead, Melanie.
Yes, thank you. Okay. Two things, just a quality of life update as I'm seeing people talk about this panel. So if you look up into the view on your screen and you click view, there's two options, speaker and gallery. If you have it on gallery, then you'll see every single person who there is to see, and you'll see them all equally, which can be confusing because not everyone that's up on the screen is a panelist. So if you click speaker, it will showcase the panelists that are on that panel. So they'll be bigger than everyone else. So it's in my view on the top right, and then you click speaker rather than gallery. So it should have a little check mark next to speaker. That's just a quality of life change you can make, because I've had some people say, we want to hear from Donnie. Donnie is one of our amazing speakers who will be on a later panel. So you will hear from him, but not right now. And then the second thing is I've seen a lot of people commenting on what are the resources from the VA. As our speakers here will discuss in the last 10 minutes of their Q&A, and other panelists, you will be hearing throughout this conference resources that are from the VA private sector, nonprofit, and grassroots. So you will be hearing from all four of those like institutions, people that are not incorporated, just good Samaritans, private companies that want to support, nonprofits, and like government support. So not every type of support is coming from the VA. And I think there have been some questions and ways that participants are phrasing that seems to insinuate that maybe there's a misunderstanding about that. Not everything that is supporting veterans comes from the VA. And the Dwyer project and the VA are not the same thing. So it can be hard to navigate, and you don't have to know which is which, but just be aware that not all of those are the same thing, and that that does affect the way we support our peers, and people will get to that, right? Because some veterans that people work with don't want government services. So they'll take nonprofit, private, or individual. Some people do. Some people are okay with it. So just be mindful as you're looking for resources, as we're presenting resources, to just be aware of that. So I hope that helps, and enjoy the Q&A. Thank you, Aynisa.
Yeah, absolutely. So Melanie, I know there was a question that we dismissed by accident from the Q&A. I think you wanted me to address first.
Yes. It was a question for Danielle. It was a question for Danielle, and I did not know you were going to ask me about
So
it. but-
how do you, Danielle, I scrolled up, I found it. How do you,
Okay,
Danielle,
perfect.
engage veterans when they feel that there are other veterans who are in much need, I guess more need of services than them?
So when I do meet with veterans, a lot of times, like I said, there are a lot of resources in New York City that I can let them know about. But one resource doesn't take away from the other one. So the resources are for everyone, but if a veteran, let's say they go to I believe the VA in the Bronx has where they can go out on the water. You have to be within the VA network, for example, but that doesn't take away from you being able to sign up with another organization, and as many vets that can join that. So one doesn't take from the other. And I hope I answered it correctly if that's what they were asking.
There are a bunch of questions that came in on the Q&A that I'm looking at now.
Can I just piggyback
Yeah,
on
please.
Danielle's answer? When it comes to services, I've come across, especially amongst our Vietnam veterans, who are like, "Oh no, give it to someone else who's more deserving, more needing," and you're like, basically by utilizing these services, we're telling the agencies that there's a demand for those services. So if we think about it like a restaurant, okay, and we put something on the menu that seems to sell out by noon every day, guess what we're going to do? We're going to buy more of that product so we can keep up with demand. If we don't demonstrate demand, if the veterans who are just basically the way I convey it to them, I'm like, hey, we're telling the federal and state government and local governments that there's a demand for these services, and they're going to recognize that and divert more resources to it. So by participating and demonstrating the need, you're telling the state, hey, we need to divert more resources, and thereby helping more veterans by just participating, if that makes sense.
Yes, thank you, Jeremy.
So this was this is a really good question I wanna address. Someone had said, thank you for your service and your continued service in the community. This is a social worker who supervises peers. So it's a two-part question, both of which are really good. What guidance do you have for this clinician to better support the peers? And kind of like a sub-question to that, the work can be both inspiring and also triggering for the peers. Do you have recommendations on how to support them in sustaining themselves in the work?
I have some
Go ahead.
experience in that. I'll be quick, Gavin. Peers may need the time to be able to deal with their own mental health issues. And so you have to kind of be aware of what they are, and you have to kind of allow them to be able to have the time to be able to do that. I was over a crisis respite, and I knew, and the crisis respite is a house where individuals come who suffer from mental illness. And the people who worked as certified peers had mental illnesses themselves, and they were in recovery. And so, as their supervisor, I knew when they were becoming symptomatic, because I knew them and I understood them, and I was able to help them in the way that they needed to be helped. Each person was different, to be able to get their symptoms under control and be able to function on the other side of recovery. And so I would say just do your very best to be aware and to know who your staff are and how you can support them. That's all.
Go ahead, Gavin.
Yeah, I was actually I was the director of our Ulster County Dwyer program. And one of the things that I definitely have to say is, thinking about a leader and a manager, because in the military service, like a leader we will follow because we know that they will stand next to us. A manager will just dictate and tell us what to do. I'm like, all right, what are you gonna tell us now? So I'll say as a leader, in your role they will follow you. So if you say, "Hey, team, I see you guys are, going through something. Let's go step away and have lunch together." Start implementing little things that encourage them to be more, be more productive. I'm sorry, not productive, but be more self-aware of like what they're experiencing. Because also that will allow them to talk more about what they're experiencing, because it might not just be stress at work, it could be stress at home that's carrying over to what they're experiencing at the job. And as peers, we have those lived experience, and unfortunately, a lot of us still carry that weight and burden into our career because we're so passionate about what we're doing that we're like, this is something I want to address. This is something I want to, help the next person with. But unfortunately, in our journey, we still carry that weight, and a lot of us don't know how to separate ourselves from it, especially when it becomes triggering when we talk to those individuals. So self-care as well as empowering those like your staff to just be when they're wherever, that's awesome, because that allows them to know that they're reaching that burnout rate, which a lot of us do, as social workers and clinicians and mental health workers. Like, we get burned out, especially in leadership roles, because we're so burdened by so much things that's happening, that we have to be the leaders to say, hey, listen, let's start separating ourselves. Let's not eat lunch at a desk, which I think we're so guilty of. Let's not, let's not bring work into what we're doing, especially when we leave the job where, we are connecting with our families, but sometimes a lot of that work environment trickles over. So it's like, how do you encourage your staff to separate themselves from what they're experiencing at work and being more engaging with their families? So also something you could say, hey, listen, let's have a team lead where one person picks someplace to go in the month, where you go bowling as a family, where the whole staff and their family meet one place and go bowling. Start encouraging those and start encouraging those other thought processes to allow them to separate themselves from what they, I think, are burdening themselves by, with stress and anxiety and all those different things. And that's something I definitely have to say, just being a leader opposed to a manager.
Yeah, and I can affirm, uh, I've known Gavin for a few years, and not only is he very good at what he does, but he wants positive outcomes for the veterans. So that's one of the most difficult things, I think, about being a peer and someone in the mental health field is we want to win, but we don't always win, if that makes sense. We want the right things to happen, but sometimes the veteran is in a place where they just can't get out of their own way, and it's frustrating because we have a tendency to look in the mirror and be like, what more could I have done? And that's a tough burden to bear, because we're agile and we try to do all these things to make things work, but we can't always. So it's important, And I think just to kind of piggyback on what Gavin's saying is that we need to meet with our peers frequently so we can start kind of triaging them and figuring out, hey, what's going on? Speaking with their family members is how's things going? Sometimes it's a simple conversation, going out to lunch, and certainly showing appreciation for the staff that we're working with, because I can pretty much say with authority, most of us in this field are grossly underpaid. I could say that probably most everybody in the human services doesn't make enough, right? And we have that tendency to look like, oh, well, these professional athletes, people show up every Sunday to watch the NFL, but we do the work that's tremendously important, but we're never going to be properly compensated, because simply there's probably not enough money to go around. And very often we're doing this, we're not pursuing this field because we're hoping to get rich. We're really hoping to help other people because someone along the way has helped us. That's what it's all about.
All right, well said. We're coming to a point where we need to close out. Unfortunately, every one of these topics today we can definitely expand more on, and that's why we continue to do this work. Melanie, I'm not sure if you want me to turn it back over to you, but before kind of officially closing, I just want to recognize and thank our panelists for their insight, their vulnerability, really speaking on the topic from both personal and professional experiences. We could not do this without you. The panelists and the committee members inform the topics, the content areas, and they also obviously deliver the content during these panels and presentations. So thank you all so much for being a part of it.